Okay, so when it comes to the musculature of the thigh and the pelvis, even though I have them on two different worksheets, it's very hard to separate them. So we're going to be basically reviewing them. And I'm going to be sort of going in the same order as we have here on our model. So as we peel away the superficial muscles on the model, we will do it on our live person. So the first one is going to be sartorius, and as we move more into these appendicular muscles, they're going to have very, very distinct origins and insertions. So you have to make sure you get them dead on. So sartorius, very, very easy palpations. You're going to have an origin up here on the anterior superior iliac spine. It's going to make this beautiful S shape that Kayla is going to mimic. So you can see that beautiful S shape in the sartorius. It's going to come down. It's going to cross the knee, and it's going to end right here on that anterior medial tibial area, what we call the pes anserine. So that is sartorius. So it's beautiful S shape coming down, long, long muscle. We're going to peel that muscle off the model, and now we're going to be left with our sort of our main anterior musculature, being the quadriceps femoris. We can palpate most of them except for vastus intermedius, but the most superficial one is going to be one right down the middle. That's rectus femoris. So we're going to palpate anterior superior iliac spine, drop down, slightly medial, push deep. There it is, slightly ticklish. That is anterior inferior iliac spine. We're going to come straight down, hit the kneecap or the patella, come down, and actually insert right there on the tibial tuberosity. So nice long muscle. Now this is a two joint muscle. It's the only quadriceps that's a two joint because it starts here on the pelvis and it crosses the knee. So it actually does two actions. We're going to peel that one off. And then we're going to be left with our vastus medialis and vastus lateralis. Interestingly, both of them insert in the linea aspera, which is actually posterior. So they actually have a little bit of a posterior origin on the posterior femur and wrap around to the anterior side. So we really can't palpate the whole origin and the whole muscle belt. We simply can't do it. But you can see vastus lateralis, a nice long muscle. So for our purposes, we're basically going to be starting here on the lateral side. Don't drop all the way over here, okay? We're not into IT Banville. We're going to be over here, so on the anterior lateral side. We're going to come down. It's going to blend into the patella and come right down here to the tibial tuberosity. For vastus medialis, we can actually merely do a quad set, tighten up her quad. And you actually can see beautiful muscle definition right there. Ooh, there's vastus lateralis too, coming around the other side. So wonderful muscle belly. So right about here, on that anterior medial side, it's going to be vastus medialis. Again, it's going to have a linea aspera, which we can't get to. Don't drop into adductorville. Stay right here through the patella and come on right there to the tibial tuberosity. And then in the one in the middle that Kayla is going to show is vastus intermedius. It's running basically straight down the thigh, straight down here. We can't palpate it because we have rectus femoris over the top of it, but we still acknowledge it and we thank it for being there for us. So that's our main anterior musculature of the thigh. Our other anterior musculature was actually going to be what we call our hip flexors, and that'd be the iliac psoas. So what we're going to do here is we're going to go back to our anterior superior iliac spine. We're going to find our iliac crest, and we're going to roll into this iliac fossa. So Kayla's going to show us we're right in that iliac fossa, and that is our iliacus. Iliacus comes from the iliac fossa. Again, anatomists are lazy. So we're going to have this wonderful muscle right here. It's going to dive deep, where you can see there. It's actually going to insert down into the lesser trochanter of the femur. We can't palpate that. That's a very evasive palpation, so we're not going to go there. But we can at least get the iliacus a little bit. And then we have psoas major, which is really coming from the lumbar vertebrae. Again, we can't palpate the lumbar vertebrae. I'd have to literally rip her stomach out and dive deep. Marilee's shaking her head, so I can understand why she doesn't want to do that. But it's basically coming from midline and then again diving down deep to that lesser trochanter. It is a little bit more medial than I care to palpate, so we're just going to know that the hip flexors are running in that general area. So that should be our anterior musculature. While we're here, we're actually going to stay, and we're just going to have Marilee externally rotate her femur a little bit and we have our 5 adductors, and you can see them over here on the model. The problem with the adductors in terms of our palpation is that they all basically are coming from the pubic or the ramus and way up there, and we're not going to even bother palpating them. For the purposes of just straight palpation, we're basically just going to palpate the lower half of the muscle bellies. Now, you will have to know their origins and insertions, so your didactic knowledge, you've got to know where they actually originate from. For palpation purposes, we can just palpate this whole medial side here. Obviously, we do remember our adductor tubercle from our last palpation, so we're going to find our femoral condyle. We're going to roll our thumb back. We're going to get right in there, and we can feel the adductor tubercle, which Kayla's on right now. But otherwise, we're going to call the adductors as a group right here. The other exception to the insertion of our adductors is the gracilis, which is actually going to insert down here at the pes anserine with the sartorius that we just palpated. So gracilis is going to come here. But again, we're going to leave the origins of the adductors alone for palpation purposes, but we are going to have to know them for just general knowledge and for written exams, etc. So that's our anterior thigh, our anterior hip, pelvis, and our medial. We're now going to roll, we're going to have Mary roll on this side so we can be consistent with the model. And now we have our lateral musculature. On the lateral side, the one we have is tensor fasciae lata. And this one's actually really easy to find also. So we're going to find our anterior superior iliac spine. Again, find the major bony landmark and work off of it. And tensor fasciae lata, we know sartorius originates there, but sartorius originates on the anterior aspect of it. So we're actually going to roll our fingers to the lateral aspect of the anterior superior iliac spine, and right there we're going to get that little muscle of tensor fasciae lata. So if Mary does a straight leg abduction, there it is, and I can feel that tensor fasciae lata right underneath my fingertips, so up where Kayla is, and we're going to follow that muscle down that beautiful iliotibial band. Again, we can palpate perpendicular to the fibers. It's going to cross the knee joint and actually insert down here into Gertie's tubercle. But you have this wonderful length of the iliotibial band and the tensor fasciae lata. Now, I know it's on a separate worksheet, but while we're here, we're also going to do gluteus medius because it's a sideline muscle. So I'm going to find that iliac crest. Again, we can just palpate the iliac crest right here. And we drop right off the iliac crest. You're going to feel a nice muscle belly right there. That is glute medius. Again, if I have Marilee do a straight leg raise, I can put some resistance there. You can see I'm actually putting resistance at her ankle. I can feel gluteus medius fire right up there. So that is a pelvic muscle as it comes down and inserts right into that greater trochanter of the femur. And actually, Kayla is going to remove gluteus medius. And if she actually takes off gluteus medius, you're going to see that right underneath it is gluteus minimus. Very small muscle. It's deep, so we really can't palpate it. Very similar to our gastrocnemius soleus relationship. But we do know that there's a nice gluteus medius there. So now that we're done with sideline, we're going to have Marilee go prone. Again, I'm going to stay in physical contact with her so she knows where my hand is. I'm going to talk to her. And as we go prone, we're going to have to actually put back a muscle. So, is that it? Nope, the other one. We're going to put back gluteus maximus. So we're going to start off gluteus maximus. Real easy to find. We're going to start with our sacrum as our major landmark. So I'm going to be right here in the middle, just like we did last time, fingers pointed cephalically. And so we have gluteus maximus coming off the sacrum at a angle, sort of downward angle, and it's going to insert into that gluteal line in the posterior femur. So we really can't palpate its true insertion, but you can see the way the fibers are oriented on the model, that sort of down and diagonal one. For us to contract gluteus maximus, we're going to flex the knee to 90 degrees. Model can't do that. We're going to ask Marilee in this position to lift her thigh off the table, and I'm going to provide some resistance, pushing her thigh back down to the table, and you will feel gluteus maximus contracting. With a straight leg, and she lifts her leg off the table, we're going to get a lot of hamstring activation. By bending the knee, we take the hamstrings off of mechanical leverage, and so gluteus maximus needs to do most of the work. This is sort of a way we can isolate two joint muscles from single joint muscles, is by bending or flexing or shortening the two joint muscle. It loses its mechanical advantage, so then the one joint muscle then is going to do most of the work. That's not to say the hamstrings aren't firing at all, but the gluteus maximus is going to be doing most of our work. Now, speaking of hamstrings, while we're here, now we're going to remove gluteus maximus from the model again. And you can see that wonderful common origin up there on the ischial for our three hamstring muscles. So again, let's talk to our patient. I'm going to palpate her ischial, okay? We're going to come up here to ischial right underneath the gluteal fold. Now, I like to start with the lateral side first because it's the easiest one. It's the only one. We're going to start here. We're going to do biceps femoris. There are two heads. We really can't get to the second head because it's deep. But we're going to palpate that first head. Boop, 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 cross the knee joint. And we're going to come right here to the fibular head. So we got our, right there, we got our wonderful biceps femoris coming down to the fibular head. It's our only lateral hamstring muscle. So we're going to make sure we cross the knee joint, and we're going to start up here on the ischial two joint muscle. Now we're going to do one of our medial ones. We're going to do semimembranosus. Ischial coming down to the medial side. Boop, 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 boop. Cross the knee joint, and we're going to stay in the posterior tibial area. So we're going to be right about here. The model really doesn't do a great job of showing it, but we'll try. And then we're going to do semitendinosus. Ischial it's going to come down, go medial, and it's actually going to wrap around to that anterior medial tibial. So this is the third muscle at the pes anserine. It's going to cross the knee joint, but this one starts posterior and wraps around to the anterior, and you can actually see it on the model right there. So those are our three main hamstring muscles: biceps femoris, semimembranosus, semitendinosus. And that are the main muscles of